Brian Mudd Show is on News Radio 610 WIOD.
Interesting update. And fashion accessory for sure for some people. And that would be quite the fashion accessory, I guess. But what about the effectualness of masks beyond the virus? You know, it's funny because I've had this conversation with multiple people. We're joined now by internist Dr. Al Johnson. And Dr. Johnson, I found this to be interesting because, we're right here in the middle of our dry season. We've had pollen that is outrageous. Dust has been really high. And I've had multiple people tell me that a benefit of wearing the mask been allergies. Allergy problems aren't near as bad. So this is something you were taking a look at. How helpful can masks be when it comes to allergy issues?
They can be very helpful. Pollen is what causes allergy or mold spores, and of course the masks filter those out. So if you are allergic, having spring and fall allergies, and you're wearing your mask outdoors, you're going to reduce your pollen exposure and intake through your nostrils, and if you breathe through your mouth. So definitely it cuts down on the allergies.
Very interesting. Okay, yeah, I had one of the people, she told me she planned on wearing the mask permanently, when certain times of year when the allergies are bad because of this. So to that end, we've talked about the effectiveness of masks relative to COVID-19. But what about, what about allergens? Are there specific types of masks that are going to be more effective than others this way?
Well, the higher filtration masks are going to be more effective. Pollens are quite a bit bigger than viruses. So any of the masks that are effective for the viruses are going to work for the pollens in that situation. And even before COVID, my real allergic patients to the outdoor seasonal allergens would wear masks, and it's effective. So it didn't surprise me that the allergy symptoms have really calmed down since masks have been worn for COVID outdoors.
We're speaking to Dr. Al Johnson. The website is johnsonmedicalassociates.com. It's johnsonmedicalassociates.com. All right, so you're an internist. I'd be remiss if I didn't ask you about the virus. Where do you think we are in the pandemic? How close are we to seeing the other side of this thing?
Well, we're on the downhill side of it for sure. I mean, the cases are going down, the hospitalizations are going down. The thing we need to be aware of as physicians is, and one thing that wasn't done with COVID was an early treatment program to get the virus before it got out of control in the system. And, different things were talked about, but there wasn't a big wholesale say, this is how we're going to try to treat it. Let's see what our outcome is, and then move on to the next step. So more and more early treatment. We have IV monoclonal antibodies now that once you test positive and you're over 55, you're eligible for those. The people need to make sure that it's infused over 60 minutes. There's some centers that are trying to infuse it faster. That can set up a reaction. So you want to have it infused over 60 minutes.
Dr. Johnson, taking a look at, kind of where we are in all this, and I think a lot of people view it as one event because it's been the pandemic. But here we are. We've been in it for well over a year at this point. We're hearing about vaccine efficacy, maybe in the neighborhood of 6 months for the Pfizer and the Moderna. What are your thoughts about, the efficacy of the vaccines and the duration and how people should look at this? Also, maybe people have had the virus and recovered that might feel that they have the antibodies, and maybe we don't know how long these are going to last.
Well, we don't know a whole bunch of things, just as you stated, but we can measure antibodies. And I measure them all the time in my patients. So we measure them at 6 months out, see whether they still have antibodies. 9 months. I have some patients approaching a year now. So I think it's important that we base our opinions more on fact than just an opinion. So we base it on scientific evidence. And if you continue to have antibodies, then you do have resistance to the virus. Now, that doesn't mean 100%. There are some other tests coming out that help us with innate T-cell immunity that can be used. So as we progress through this, doctors are going to have to be aware of how to assess their patients as far as their immunity goes, and not just take that everyone is the same, that it all works the same. We all have different immune systems. And so each one's an individual, and you have to assess it as an individual.
Well, that's really interesting information. I appreciate you taking the time to share it with us. Thank you.
Oh, you're welcome. And stay healthy and safe.
Yeah, you too. Amen. It's Dr. Al Johnson. And again, JohnsonMedicalAssociates.com, the website.